Do you know what the leading causes of death are in the United States? Number one, is heart disease. Two is cancer. But according to new research, number three is medical error. The study published in the BMJ, formerly the British Medical Journal, estimates 251,000 people die every year due to medical errors at hospitals and other healthcare facilities. That's more than respiratory disease, accidents, stroke, and Alzheimer's. According to the study's author, a professor of surgery at Johns Hopkins, it boils down to people dying from the care that they receive rather than the disease for which they are seeking care. Joining me is Dr. Tejal Gandhi. She is President and CEO of the National Patient Safety Foundation. Doctor, thank you so much for being here. I was stunned by this number. You're probably not surprised, were you?
I was not surprised. We've had estimates of harm from medical error from even back in 1999 that talked about error rates close to 100,000 deaths per year. And those methods were probably not as accurate as some of the newer ones.
And they say these are deaths. They say injuries are maybe, I read today, 40 times as much. So we're talking about 10 million injuries a year from medical error?
That is accurate.
Is it as bad in Massachusetts, sort of the international home, theoretically, of great healthcare? How do we compare proportionally?
I think it's hard to say how Massachusetts fares. I wouldn't say that we're probably any better or worse than anywhere else in the country. We do have very esteemed academic medical centers here, but we know that these kinds of errors can happen anywhere.
They say 23% of people in Massachusetts say, this is amazing, they know someone close to them who has suffered from medical error. So what's the primary cause? Is it overwork? Is it concurrent surgery like we read about in the Boston Globe? What are the primary causes of this?
Well, you have to understand there's many different types of medical error. And so, you can think about medication errors, you can think about diagnostic errors. So there's lots of different types, and the causes of each are very distinct. So there's not just one cause to these errors. Usually if you look at an error, there's multiple things that went wrong to lead to it.
Is part of the problem of the reporting is that doctors cover for, we've always talked for years about how cops cover for cops. Do doctors and medical people cover for other medical people? Is there an unspoken, notion in the industry or no?
Well, I think there is a culture where there's a lot of fear about talking about errors. There's a lot of blame, and this is something that we've really been trying to change over the last 15 years, to create a culture where people are more comfortable talking about errors. It's really important to be able to openly talk about errors, because then we can learn from them and improve.
So is that that's obviously one of the ways you fix it. I mean, institutional changes, give me a couple that should happen to reduce this obscene number, 250,000 a year.
Well, and let me be clear, for the last 15 years, hospitals, health systems, ambulatory sites have all been working really
still
hard.
Still 250,000 people
Still
a year.
a quarter of a
So
million
how do we
people.
reduce the number?
Well, I think there's several things we need to do. One, the article really talked about is better measurement. So we still don't have very good measures of the harm that's occurring.
Okay.
And so there needs to be kind of at the national and even international level, better metrics. One area where we've done that is infections. So hospital-acquired infections, we actually have very good measures of those, and we're starting to see significant reductions because now we can measure.
So even knowing the numbers helps improve the incidence of this
Because
thing.
then you can start to understand causes and why is it that it's higher here versus here, and
What else?
understand. So the thing that we talk a lot about is culture, just like we started to talk about. So creating that culture where people don't feel like they're going to be blamed, punished, and fired.
But they are going to be blamed,
for
punished,
errors.
and fired. They'll probably get sued if they admit that. I mean, isn't that part of the problem?
Well, it is part of the problem, but most errors don't end up causing suits. And we've really worked to change the culture so that it's not about blame and punishment. If you look at an error, it is extremely rare that it's because an individual tried to make an error, right? So it's about human beings are always going to make errors,
Sure.
and we need to have systems that catch those errors.
Okay, well, you're fixing it institutionally. I'm going to the doctor or going to the hospital next week, the generic me. I mean, all I think of is Betsy Lehman. Betsy Lehman, crack health columnist for the Globe, died 20-some years ago. She not only was an expert, her husband worked in the hospital. She was complaining about an overdose of chemotherapy, chemo drugs for her advanced breast cancer. And I say to myself, if she couldn't prevent this, how do I?
Yeah.
What can I do to make it less likely that I'm a victim of medical error?
So that's a great question. And I have to say, even personally, when my father was in the hospital, I was there 24/7 advocating to check to make sure things went well. So that's the first thing I always
But
say
for
is,
those of us who can't bring you with us.
no, but have someone with you.
Okay.
Because my brother, who has nothing to do with healthcare, he was advocating as well when I couldn't be there.
Just as a presence.
And it made a difference
What
in
else?
terms of asking questions, in terms of being able to understand the care plan. So having an advocate there, asking questions all the time, really understanding why you're getting certain medications, what is the plan, why is that the plan. You know, I think patients are often very nervous about asking questions, and we talk a lot about patient engagement, and what engagement means is partnership. So you have to be able to ask those questions. You know, the third thing is really understanding who's in charge of your care. Often when you're in a hospital particularly, there's a lot of different people coming in and out of the room, so understanding who's in charge and who's making decisions. And then, you know, I think when it comes to things like medications, particularly understanding what they are, what they're for, these are some really practical things that I think that are hard but necessary.
Doctor, thank you so much. Good luck with your work.
Thank you so much.
Our lives depend upon it.